All right, looks like we're live. Welcome.
Hello, good evening.
Yeah, thanks for joining, Dr. Navity.
Dr. John Santa Anna.
And we're both providers here at the Michigan Center for Regenerative Medicine. And tonight's topic, we want to help you all explain or understand how our clinic differs or would differ from some other regenerative medicine clinics. If you're trying to shop around and look for a good clinic, our plan today is to, one, give you a tour of our facility and introduce you to some of our staff members. But number two, just give you some general ideas of things to ask and questions to ask and things to look for in getting a good quality regenerative medicine procedure.
Yep. So this is more educational for everyone. We want everyone to know that when they look at regenerative medicine clinics, there's a few things that you want to look at and other people's credentials as well as their capabilities. And at the same token, we also want to show off what we've built here in Michigan because we are really proud of what we've built here.
Yeah. So I guess with that, we'll get to kind of our list of items we want to cover tonight. So if I don't say so myself, I think the number one thing that would set us apart from other clinics in the area is both Dr. Santa Anna and myself. Our backgrounds, our skill sets, our passions, and specifically, we're both physical medicine and rehabilitation physicians, which that training sets us up to evaluate orthopedic conditions, things like neck pain and back pain and shoulder pains and knee pains, and really take a non-surgical approach to trying to manage those conditions. So physical exam skills and other diagnostic interpretation of MRIs and things like diagnostic musculoskeletal ultrasound. We both have skills in evaluating conditions right there at the bedside, right when we're doing our evaluation with you, where we can actually see structures and abnormalities.
Yep. And then we both are trained in interventional pain as well. So being able to translate those diagnostic skills into interventional procedures, which are, least invasive in order to target certain areas in your spine and in your joints and certain nerves, gives us that added advantage with regenerative medicine and how it translates with our training.
So in the basic difference between interventional pain and interventional regenerative orthopedics or orthobiologics is really a different target and some different ideas for where you want to inject. But the whole concept of seeing your target and taking a needle and being able to accurately drive that needle to your target using either ultrasound or X-ray guidance is really the core of our interventional pain training. So that leap from going from interventional pain to regenerative medicine and interventional orthobiologics, it's a pretty good steep learning curve. And that would be one of the take-home points from tonight's discussion is know your injector. Ask your injector, what their credentials are, what their backgrounds are, and how are they skilled in making sure that they're delivering your product, be it a PRP procedure or a stem cell procedure, whatever it is that they're injecting. How do they know that they're injecting it into the target tissue? What's their skill set and what kind of imaging guidance are they using?
Yep. And the other thing that's a little bit different between interventional pain and interventional orthobiologics, interventional orthopedics, is how we look at these structures that we're treating. So typically with a pain injection, the idea is to do an injection right at the site of pain. You pinpoint the spot and we inject right there. So that talks a lot with the accuracy of what we do. But with interventional orthopedics, the big thing is looking at everything as a functional unit. So how everything relates to each other, how this nerve is affected by this joint, how this joint is affected by your ligaments and your tendons. How do they all function together? How are they dysfunctioning right now because of the injury that you have, or some laxity, or some biomechanical failure that you have? So with regenerative medicine, it's a little bit more than just getting the product directly at the target tissue. You want to be able to target that functional system as well.
I guess the next topic that we'd like to include, what separates us from other clinics and what gets us, I think, better outcomes than other clinics is what exactly we're injecting. So we have a very advanced lab that we do on-site processing of either your blood or your bone marrow, and then we concentrate those cells and do a cell analysis so that before we inject it, we know what quantity of either platelets or what quantity of stem cells we're injecting into you. I think that's an extremely important step that not very many clinics do. It's the number 2 question I ask patients to make sure they ask when they're getting a consult is, how do you know what's in my syringe? If you don't do analysis, if you don't do a cell count, to me, that's the akin of doing an injection with a drug and then not knowing what dose you injected. You ask your physician, hey, doc, what dose of that drug did you just give me? And if the doctor shrugged his shoulders and said, I don't know, that wouldn't be acceptable. And right now, for whatever reason, that is acceptable in the regenerative medicine community, but we don't believe that should be. In order to get optimal outcomes, we should be injecting optimal concentrations of either your stem cells or your platelet-rich plasma.
Yep. And we've tried different kinds of delivery systems in order to kind of process our PRP and our stem cells. We've started with our bedside centrifuges. We tried creating our own system. But at the end of the day, it's nothing really compares to our current lab setup where we have a whole setup where it's certified and ran by a lab tech, and it's manually performed, and it's professionally done.
Yeah, so it's a company that we partnered with, and they have been doing this much longer than Dr. Santana and myself. They started by managing the lab out of the Stedman Clinic in Vail, Colorado, which is a premier orthopedic clinic in the world, really. Yeah. That was on the forefront of incorporating regenerative medicine procedures into their orthopedic surgeries and other standalone procedures. And now they have a program where you can affiliate with that lab, and we get the same protocols that they implement when they change centrifuge speeds, centrifuge times, how far to go into the buffy coat, what equipment to use to maintain sterility and ensure optimal cell counts. We get the benefit from all that information that they're gathering for the years of experience that they have. If I were to get a family member an injection of either stem cells or PRP, I want to know that they're getting the best possible solution. And I do believe this company provides us that.
Yep. And I'd like to say that, we're able to give world-class care because of that. Even though we're a small little dot here in Michigan, we're able to deliver world-class PRP and stem cells or regenerative medicine treatments with our affiliations with them. And I'm proud of that too.
So, the first thing that I think separates us from other clinics are the providers and the skill of the providers. The second is our lab and the quality of the injectate that you receive, whether it's a PRP or a stem cell. The third thing I wanted to make sure to bring up is our staff.
Yeah,
we have an incredible staff. As Dr. Santana has pointed out, very proud to say that every one of our staff members that we've started with is still with us. 5 years later, we've had zero turnover. I think that speaks a lot to the atmosphere, the community we've built, and the knowledge that they've gained over those years. So before this, we were just talking about the growth we've seen personally, professionally in our staff, the knowledge they've gained, how well they interact with patients. They know our patients by name. They know our patients oftentimes better than I even know our patients.
Yeah.
They know my first name. They manage the schedule extremely well. We're very accommodating and getting people in quickly and at a time that's convenient for them and works their schedule. And again, I think that's just something that I'm very proud of in our staff and their knowledge and their ability to interact with our patients.
Yep. And I think the biggest thing too is that our staff really believes in our mission. Our mission and our goal of this clinic is to deliver the best possible care for our patients. And that starts from the front, from picking up that phone call, talking to the patients, just asking questions about the clinic, how to schedule. And then from there, making sure that they get all their records correctly, making sure that they're scheduled correctly. And then after that, getting more information, ordering testing, coordinating travel, hotels, if needed, for all that type of stuff, trying to accommodate patients as much as they can, because they do believe that this is the best possible course for that patient. And I think it's pretty rare that you'd find people in that same mindset and that same goal kind of working towards it. And, we've grown our practice from, like a 4-man operation to what it is now. And it's because everyone just is really focused and really believes in our mission. And this is what we want to do.
And it's fun. I think our patients see that we genuinely enjoy coming to work. We genuinely enjoy helping people, and we will bend over backwards to do what it takes to get you what we think we need. One of the things that frustrates me the most about our healthcare system right now is I'll be in a consult with a patient, and we'll be discussing their condition and what we think is best for them. And unfortunately, the most important thing, potentially the most important person in deciding that what's next for them or what's best for them isn't in that room with us. It's some insurance provider or someone who's dictating what will or will not be covered. And to have people that are willing to fight for you if it's something that you need, and if it's something we potentially could get your insurance to cover, to know that our staff are fighting on your behalf, I think it's a testament to how much they want to help. As much as Dr. Stanton and I want to help you feel better, we have staff that feel the exact same way.
Yep.
Next on my list to talk about our facility. We have come a long way in the 5 years that we've been a practice, from where we started to where we're now. It's been quite a growth journey, and we have built a state-of-the-art facility that is designed specifically with regenerative medicine in mind. So the layout and the equipment was designed specifically to provide the types of services we're providing now. We've been in this new facility for over a year now, and we're really seeing the fruits of our labor. The ability to schedule patients in one location for their consult, their procedure, all the equipment that we've acquired, the X-ray machine called a C-arm, the ultrasound machines, our on-site lab, all the anesthesia equipment that we have if we're to provide anesthesia. It really makes it convenient, not just for us, but for our patients, that we aren't having to utilize outside surgery centers, outside hospitals, any kind of outside clinic to provide world-class care.
Yeah, I think it's a good transition now to maybe show our a clip of our facility, and then so you better understand kind of what we mean by how we built this from the ground up. This is a blank slate that we decided to create, dedicated primarily to regenerative medicine and the things that we do. So, and we're proud of it. So, enjoy.
Yeah. So, and we'll give a little narration to this. Okay. Let me go back here. All right.
Wow. Space bar.
There we go. All right. Thank you. So, as you can see, this is our front entrance, and we are in a facility with a couple other medical providers. Located in downtown Rochester. One of the things that's really nice is we do have our own free parking. So at the downtown location, to have your own parking lot is
pretty rare.
Pretty rare and prime. This is Amber. She's one of our receptionists that will greet you if you come in, when you're answering the phone. Taking you through our entrance here into our patient exam rooms.
This is our coffee bar. You know, we do have, when we do have procedures performed for our patients, a lot of times family members come along as well. So we want to be able to offer some refreshments for patients and chauffeurs and drivers for the day. We have a regenerative esthetician nurse, Tina Polich, and she likes performing these procedures with aesthetics in mind. along with an Emsella chair for urinary incontinence and sexual wellness for males and female. And then these are our exam rooms. Again, sufficient to be able to explain to patients what the procedure is and how to properly do the diagnosis.
This is our procedure hallway. We'll see our 2 procedure suites here shortly. The first one here on the left, that's our X-ray machine, our C-arm, and
our main OR, I should say.
Yep, and then our ultrasound machine here on the left, as well as our anesthesia equipment with the tool chest there, and then OR2, oftentimes used for recovery. We do have the ability to do EMGs here, as well as the other machine in there was the nitrous oxide machine.
Yep. So with the 2 of us here and having the 2 ORs, we can run 2 rooms simultaneously. The OR2 has the ultrasound guided procedures that we can perform there. And this is the lab. This lab is solely run by Grayledge. They have their whole setup over here. They provide and train their own lab tech that's being managed by the staff over there in Vail, Colorado. And all their supplies and essentially everything that they need to have this lab run correctly is led on by Grayledge.
And it is, one of the probably most important things that separates us, being able to process here on site. You can see the centrifuge, the vented hood for sterility, and then the machine on the right-hand side is our cell analysis machine to make sure we have the proper dose before your procedure.
Mm-hmm. And the way we built it is that we want the lab to be in really close proximity to the operating rooms, because that should limit any room for errors or things like that.
And prior to doing this location and having on-site abilities, we were using outside surgery centers and required currying the cells back and forth from our lab and our office. And not only from a timely standpoint was that inconvenient for everyone, it also posed that risk for sterility that we really wanted to eliminate.
Yep.
So we've covered a lot already. I think talking about the providers, our lab, our staff, our facility. I think our location kind of speaks to a lot about us. Both Dr. Stanton and I live in downtown Rochester, as well as work in downtown Rochester. This is our home. This is where we live. This is important for us. Outcomes are very important for us. We like seeing our patients. We treat friends. We treat family. We get people better, and we're not afraid to run into them around town and see them around town. We like our patients. We get people from certainly outside of Rochester, outside of Michigan. People come from Canada, from Chicago. They do travel to see us, but this is where we live. I think it's important for us to be proud of the community we're living in, that we are really proud of our work.
Yep. Yeah.
It takes a team to get good outcomes. I think we have an excellent team here, both in-house as well as the other services we use, other companies. We have great relationships, and I do think we have a pretty unique clinic that can help people that have seen a lot of other providers, that have seen a lot of other traditional medical therapies. And if it's something you're thinking about, regenerative medicine being an option for you, I would really encourage you to call us. We do telemedicine consults if you're not close, and we would love to take a look at your condition, see if it's something we could help.
Yeah. Well, we have some comments here from the crowd if you're ready for it. So Christopher commented, very impressive. come a long way. What is next for you folks in 2022 and beyond? I would say just continue doing what we're doing. It's we definitely want to expand some more, and maybe bring in another physician or something along that line. But our primary goal is to just continue what we're doing, build on this momentum, and really try and make Michigan Center for Regenerative Medicine the destination for regenerative medicine in this area. Like I said, our goal is to bring you high quality, world class care, and Dr. Nabity and I and our entire staff. That's what we want to dedicate all of this to.
Yeah, a growth, getting the word out, letting people know this is an option. Unfortunately, it's still one of those things that not everybody understands is an option for them. They think drugs and surgery are their only options when they have chronic pain coming from an orthopedic condition, and we're here to tell you, no, it's not. There are other things that can be done. You don't necessarily need to take the risk of surgery, the downtime of surgery, and the fact that surgery doesn't always work. We've got some great patient testimonials, I think, on our website now. We've really treated a lot of people, and I'm not going to tell you 100% of people have gotten better, but a large percentage of them are. We're tracking our outcomes. We're doing studies. I think, I guess to answer that question, that's definitely one of my goals for 2022 is to start publishing, to really start moving the needle for making this the standard of care. And in order to do that, we need data. We need data, and we need to publish, and you can see the momentum starting to move in our direction with societies like the American Academy of Orthopedic Surgeons endorsing regenerative medicine as a legitimate medical practice that needs to be incorporated and looked at, and we want to be part of that.
Yeah, absolutely. And then, like I said, we've again partnered with, as far as patient registry and tracking our outcomes, we partnered with Data Biologics as well, and along with other like-minded clinics like us in the entire country. And we wanted to make sure that everyone sees that these are real outcomes that we're getting, and I think pretty soon it's going to be published and out there, and it's something I think the public should really look into.
Well, we really appreciate everybody taking their time on a Tuesday evening to hear us out and take a look at our clinic. Again, would love to schedule for a consult if it's something you think we can help you out with. Our phone number, if it's not on here anywhere, it's 248-216-1008. And again, we're Michigan Center for Regenerative Medicine. Regenerativemedicinemichigan.com is our website. Hope to hear from you.
Thanks again, and everyone have a good evening, and stay safe.
All right. Thanks, everyone. Bye.